Hi everyone, thanks for joining. We're going to get started now. Just a reminder, 30 minutes, one question, one follow-up. Today we have Dr. Williams and Dr. Yaffe here, so I'll turn it over to them for some brief remarks.
Yes, well, good afternoon. And outset, want to wish everyone a happy and healthy new year. I hope that you celebrated it safely and that you took a moment to reflect on the strength and resilience it took to get through 2020. It was a challenging year, I know, for everyone, and I know the sacrifices many made were difficult and continue to be difficult in so many ways as we move forward into 2021. And we're optimistic that with the vaccine program started, that we're moving in a direction. There's light at the end of that tunnel as we continue to progress and work on that. But at the same time, I know that we can't let our guard down. We still have some escalating numbers to talk about shortly, and I'll do that first and then hand things over to Dr. Yaffe to talk about some unique aspects related to cases in a moment. So we know that as we look at the end of the year, we are in our lockdown period, started, of course, on midnight on Christmas Day evening, which is on the 26th at 12:01. And so we are still waiting to see the impact of that lockdown period. We're seeing a lot of the numbers in the last few days related to the days just before that time. And of course, that has been concerning because they were rising, as were the hospitalizations and deaths up to this time. And so December, we saw alone some of the highest numbers in a daily basis that we've seen. And we're hoping that in January, we will start to turn that around. Although some of the numbers we're seeing in the first few days of January, as I said, reflect that time period relating up to just before the time of the lockdown initiation. So we're hoping to see some abatement in those numbers as we move into the latter part of this week. And we're into the post-lockdown initiation time. So on that time, on Saturday, we did see 3,363 new cases. That was a record. And we were down a little bit to 2,964. But now today we're reporting back up to 3,270 again. And we'll have to see how that goes. In those numbers there, between Toronto, York, and Peel, that made up 58% of the cases of the total amount. But that still leaves quite a few that are outside the area of Toronto, Peel, and York. We've seen those numbers increase over the last few days. And even though we are setting aside the framework at this time, we are still watching the numbers and we're reviewing those on a weekly basis to see where are the different health units progressing and changing. And we've seen a number move up into the red zone / gray at this time with over a week ago 21 of the 34 in the red zone and a number of the others progressing up. So there's only 4 left in the green zone as of the end of the year. And so we're going to see how the numbers are early in this week coming up. We saw another 149 Ontarians in this time period since January 1st, unfortunately, have lost their lives to COVID-19, and 1,190 people are currently in the hospital, and 333 as we move close to that number of over 350 in our ICUs, which, as you remember from our modeling group, was a concerning amount, and we're seeing more and more our hospitals being pushed to the limit as they're trying to deal with that by curtailing elective procedures and trying to hold the line, because not only are the numbers high in the ICUs and the hospitals, but staff, of course, some are getting ill and coming in from the community high spread, and so that does certainly curtail capacity to deal with these numbers. So we're addressing that as assertively as we can at this time. It does mean that we still, even though the vaccines are coming, and as you know, we are rolling that out, and we'll have some comments to make about that, with both the Pfizer product out into our various sites, going from our original 2 up to 19, heading to 21 sites, and they're moving assertively in all those ones with strong, I would use the word command from General Hillier to keep moving that up and get those numbers up fast. And we are well over 45,000 at this time in there. The Moderna vaccine has arrived. We are starting to move that out on the weekend and going into long-term care facilities, and that's moving stridently forward at this time. So it's all going ahead forward aggressively at this moment, and more to come and more to deal with. So we have that challenge ahead of us, but we still have high numbers to deal with, and we still have to maintain our vigilance as before. with the masking in public places, with the distancing, with limiting time outside the household, with not having any contacts outside of your household group. We're trying to limit travel and to limit those aspects only to very essential and critical purposes, even within the province and interprovincially at this time. So we cannot say just because vaccines are here, we can be casual on, because you're seeing the numbers have gone up fairly aggressively over the holiday season, and people, I would think, have not maintained total vigilance in that regard. And yet at the same time, I think a lot of people did so, and I applaud them for that and ask that you would stay vigilant, try and push back the COVID fatigue. Vaccines are on the way, but we have another month or 2 or 3 to push forward on this one here while we try to deal with our most vulnerable and highest priority groups first and get into that. So those are my comments at the outset. I'm going to ask Dr. Yaffe to comment on some unique features of some other issues around COVID-19 at this time before we open up for questions. Over to Dr. Yaffe.
Okay, thank you very much. So with respect to the COVID-19 UK variant, we do have some updates. We have an additional 3 cases to report, bringing Ontario's total to 6. All 3 of the new cases have traveled or have had close contact with someone who traveled outside of the country. The first case is a resident of York Region with recent travel to the United Kingdom. The second case is a resident of Peel Region with no personal travel history, but a close contact of a confirmed case with a travel history to Dubai. The Public Health Ontario Laboratory currently has the sample from the individual who traveled to Dubai, and it is being tested for the UK variant. The third case is in a resident of the City of Toronto with recent travel to the United Kingdom. Case and contact management is being performed by the relevant public health units. I do want to take this opportunity to remind Ontarians to travel only if absolutely necessary. And if you do travel, you must maintain your quarantine for 14 days upon return to the country. I cannot emphasize how important this is. COVID-19 does not know borders. Thank you. And with that, I would like to turn it over to the media for questions.
Go to the phone lines. Just a reminder, 1 question, 1 follow-up. Over to the first question, please.
From Chanel Call at CP24. Please go ahead.
Hi there. Thanks for taking my question, doctors. I wanted to ask today about long-term care homes. Some new data that we're looking at comparing the first wave to the second wave shows that on May 18th last year, there were 190 homes in outbreak with 2,300 active cases. And then some more recent data on January 3rd shows that there were 219 homes in outbreak with 2,270 cases. So the province keeps saying that work is being done to sort of minimize the spread in care homes, but these numbers kind of showing that we're seeing more outbreaks now than we were back in May. So is what we're doing right now working?
Thank you for that question. Certainly, long-term care is a very high priority, that the population in there is very vulnerable. Seniors, people who are frail, who have a lot of comorbidities, and they're in a setting where transmission can occur, particularly in the older facilities where they have rooms that house up to 4 people and share a bathroom. So the conditions are difficult. So when you have communities where there's a lot of transmission, which is happening in Ontario in a variety of communities right now, the chances of it getting into a facility are increased, unfortunately. Of course, there is ongoing screening of staff, and that is going on and increasing. There's more and more support for infection prevention and control, and ongoing work to support staffing. But these are ongoing efforts, and certainly issues are still there, and we do need to keep working on it. And the Ministry of Long-Term Care is working very hard to increase supports to that sector. But again, we're dealing with a pandemic where we have a lot of transmission in the community, and we're dealing with a very vulnerable population. So it is an ongoing challenge.
Follow-up.
And you mentioned support in staffing. The UHN is now coming in to help St. George Care Community. That's the home with the highest number of cases in the province. And now we know that hospitals have stepped in to help about 31 homes so far. Are you concerned at all, doctor, that if the outbreaks continue at this rate, there simply won't be enough staff to keep stepping in?
Well, as I said, human resources are a big challenge in these situations because staff that work there may become ill themselves and have to be off, and so that we need to bring in more. They need to bring in more staff, particularly registered nurses and physicians. So the hospitals have been extremely important in this, working together with the Ministry of Long-Term Care, coming into the homes and supporting them in a very important way. And I know that the ministry is working on bringing on more, training more PSWs, getting more nurses, and physicians coming in. So in the long run, of course, if necessary, we could bring in other people, retired people, and other staff. But it has been improved. And for example, tender care, I know at this point, I just spoke to a physician at Toronto Public Health. They do have adequate staffing now. And so it's certainly a priority, and it's a very important aspect of the control of those outbreaks.
Next question.
Randy Rapp, CHCH TV. Please go ahead.
Yeah, hi, doctors. Does Ontario have the lowest vaccination rate of any jurisdiction in this country?
So we're getting the numbers coming in. If we're talking about rate, like per 100,000, of course, we have a bigger denominator. And so we'd have to do a lot more. Some smaller jurisdictions can do a certain number and have that rate up fairly quickly. I think we're moving to equal the rest in the number of vaccinations given in that. And we've, as I said, we're progressing with our sites, going from 19 to shortly 21. And we're hoping to go through all our current stock of the, especially the Pfizer product, fairly assertively. We're waiting for more to come in as we get notification of that. And we, as I said, we have the Moderna out now and start on the weekend, going to long-term care residences in that aspect there. And so we're moving on all grounds and moving assertively forward in all areas there. So we haven't compared, I haven't looked at the rates compared to other smaller jurisdictions. In order to meet those, we'd have to do that, and we do need a lot of vaccine. And of course, we're looking for our federal counterparts to keep that flow going, because as we pick up the pace, we're going to need a lot more coming in quicker. So we hope that source will keep up with us in that regard.
Follow up.
Earlier today, Premier Ford said that it's not surprising for there to be bumps in the road as far as this vaccination goes. What was he talking about? What bumps in the road have you seen that he would be mentioning?
Well, I think in rolling it out, you're going to take a product, especially the Pfizer product, that has those logistical challenges of the very cold temperature, limited movement, supposedly the vaccine. Right after it's out, it has to be diluted and used in a very short time period. So we had to look at using it within the jurisdiction of the locale that it went to, first Toronto Hospital, UHN, and then to Ottawa, and then the other sites. So that means getting a number of people into those locations, and sometimes that's a bit more challenging, especially if you're bringing staff in who may not be on the shift at that time and they're coming from larger distances out. So all these aspects of bringing people in at the right time and the right way to get the right numbers, getting the data entry, making sure everything's according to the monograph and systems set up by the company. And so these things that seem mechanical, they all have to be carried out, and you have to get the people to those sites. We're looking at how we might be able to get that out to other sites, and we're asking for permission to do so. So we're trying to deal with those bumps, if you may, in the road to expedite the rates of vaccination. I know that General Hillier wants that picked up as aggressively as possible. So we're overcoming those live time. And then when we got the second vaccine, the Moderna, how to get it out to those locations, trying to focus on our previous gray zones, that mostly Peel, York, Toronto, and Windsor, and how to move assertively on that. At the same time, we want to make sure we're covering our Indigenous communities, especially the rural and remote ones, and working in partnership with them to get it done in a timely way in cooperation with the leadership in each of the communities and with the chiefs and band councils.
Next question.
From Mike Crawley at CBC News. Please go ahead.
Hi, Dr. Williams. More about vaccines. If right now it seems that it's about 4,000 vaccine doses per day that are being administered. What is the target and time frame for increasing this to a more significant number? Are there any numbers that you can tell me that you plan to be trying to vaccinate per day, by the end of the week? Just contrasting that with, some other smaller jurisdictions that seem to be vaccinating at a far faster rate than this, and the fact that there's 100,000 or so vaccine doses sitting in freezers in Ontario right now, as far as I can tell.
Well, our target, I know the general would like us to move up each of those sites up to 1,000 a day. And to move in that direction, we have, of course, the Moderna, which is a different one that's moving out into working with public health. And they're hoping to get most of the residences done by the middle of January, in the gray zone ones, that is. It's the long-term care facilities, staff and residents. So that's fairly aggressive timelines. That means very much so we may be very soon a factor that we're going to have the vaccine flowing in a very timely fashion. So that's going to be in a supply chain management aspect, the different limiters. So as you move up the uptake, the intake has to increase as well. So it's a fine balance, and we want to max it as best as possible so that whatever's coming in is going out. I would correct that there is not 100,000 sitting in the refrigerator at the moment. We're moving through it fairly assertively, and we're hoping to get some more fairly soon to keep that up at that pace. So once we set that moving target, we're going to have to make sure we get the same supply management coming from our federal counterparts through the manufacturers, so we can keep that pace up in Ontario, which, as you can see and you heard, our numbers, of course, are much larger and significant than some of the smaller provinces and territories.
Follow up?
And on the infection rate, I mean, you mentioned that the province-wide lockdown has really only been going on since Boxing Day, Christmas Day, and we haven't seen, the evidence of the impact there. But the lockdown in Toronto and Peel region has been going on for far longer than that. How do you explain the fact that the numbers have not been coming down in Toronto and Peel, despite the number of weeks that have passed since the lockdown was imposed?
Well, it's a good question there. And as I said before, with the lockdown, and I guess the one encouraging part is that even with the celebrations over the season, and that while they've had 1 or 2 days that blipped up with some different data entry issues there, and our testing, like even on the weekend, which is very unusual, we did a record of over 70,000 tests in one day, and that is a huge achievement to put that through. So we're getting lots of people coming forward. While Toronto and Peel, as projected by the original modeling, would have been well over 1,000 cases a day by their size and numbers, they have kept that pretty well level at the 1%, 1.0 or 1.01% rate, which is an achievement. We're seeing a lot more in workplaces. I think you've heard some things from Toronto Public Health, and Peel said the same thing. So that's been a concerning aspect there. So while their numbers have not blown past 1,000 up to 1,500 to 2,000, which is good, we would like to see those numbers coming down more assertively. A lot of the other numbers in the outer provinces, outside Toronto, Peel, and even York's gone up. They are continuing to climb. So that was very concerning over the last few days. So we're hoping to see those numbers stabilize and come down, back down to the 1.01% rather than the 1.03% rate increase, as with our modeling, if you recall, 2 weeks ago. And so we're hoping to get some updates from the modelers as well. So the good news is that some of the numbers have not climbed in those big areas as big as they could have. The other side, we'd like them to have come down even sooner.
Next question.
From Shalina Maharaj at Global News. Please go ahead.
Hi there, doctors. Thank you for taking my questions. The first one is from my colleague, Morgan Campbell, and this concerns long-term care homes. Has the ministry looked to other provinces for guidance on how to handle long-term care outbreaks? For example, both Quebec and British Columbia were able to onboard nearly 17,000 personal support workers during the summer, and Quebec has mandated the addition of infection control managers in long-term care homes. Those provinces are both reporting fewer cases in long-term care homes.
You know, really, for that specific kind of thing, you'll have to ask the Ministry of Long-Term Care to respond.
Sure. My follow-up, this one is more to do with the vaccination rollout. So there are healthcare workers on social media who've been using the hashtag ready to vaccinate. They're expressing their willingness to help administer the vaccine. Why haven't officials reached out to any of the family doctors, nurses, pharmacists, paramedics to help get past those bumps in the road that you described and that the Premier described as well earlier? And are there any plans to initiate those talks and to get the ball rolling?
So I think it's great to hear that those individuals are wanting and willing and able to participate. We have to make sure that the sites we're operating out of at the moment have been our hospital sites, and then going to the long-term care facilities, because what you have to understand is that there's vaccination and there's a vaccination program. And while some people want to just vaccinate writ large, we really want to focus that we're running a vaccine program to make sure we try and make some impact as soon as we can on these high-risk areas that you've been asking about with long-term care, et cetera. And unless we get those places there with a 70% uptake in the staff, and I'd like to have 80 to 90% uptake in our residents, we won't see a lot of impact in reducing those areas there. So we would really like to see the program focus, while our vaccines are of smaller, very small quantity for the province of Ontario. We're not talking about huge numbers right now that are coming in, and so we want to focus on that. That means individuals who want to take part would have to do in the context of delivering those programs, and how would they be willing or interested in undertaking that. So we're trying to add to that. We're looking at the prototypes for how we expand in those long-term care facilities, bringing in public health at the level there, and as well as looking at some concepts around mass vaccination and how we do that, and then what regulations and directives will we need in place to legally permit that to occur. So all these, a number of channels to look at those bumps and get those out of the way as we progress forward, are being looked at stringently right now, and we hope to have all those in place. So we like those emails coming in. We like people getting ready to step up to the task, and that's very encouraging. And I know that General Hillier is more than interested to know that people are willing and hopefully are able to undertake that when we open the doors up, and especially when you get the big numbers that when we get up to have to do 400,000 to 500,000 people easily in 3 or 4 days over an extended period of time from April on. We're really going to need that workforce out there.
Last question.
From Kelly Grant at Globe and Mail. Please go ahead.
Hi there. Thanks for taking my question. First off, Dr. Williams, could you clarify how many doses are actually sitting in a freezer right now? Because as far as I can see it, the federal government says that Ontario, as of the end of the year, has received about 148,000 doses of the two vaccines. And Ontario is reporting that they have administered about 42,000 of those doses as of this morning's update. So can you clarify, are there not more than 100,000 doses sitting in freezers in Ontario?
Well, if you do your calculation there, if you take 45,000 of that and you take that away, most of those number 148 includes the Moderna that they sent to us as well. And so you have to add that number in there. And we have administered most of the 45,000 that you're hearing on the report is from our sites, our hospital sites. We haven't yet entered our data yet for the early programming on the weekend and in the long-term care homes with the Moderna, just simply because we move quickly to vaccinate a large number, and it's been paper-based, so we hope to get those numbers added into our total fairly soon. So most of our numbers there, the 45,000 that you're seeing, relate to the application of the Pfizer products.
Follow up, and this is the last question.
Okay, can I ask about the viral genomic sequencing? Dr. Yaffe mentioned those 3 new cases of the UK variant that had been identified. Can you tell me how many viral genomes from positive cases Ontario is currently actually sequencing?
So I have the number. I mean, like our lab has been following and doing on a regular basis before we even had our cases that Dr. Yaffe spoke about of looking for the UK per se. They've been doing regular genomic sequencing. Almost they did 4,000 at one level, another 2,000, so about 6,000 sampling across all our ones coming in to look for any variations and looking for any changes and alteration in the COVID virus as it progresses. The UK one is a separate one that they're looking at because they have that, of course, in their record now. And that's one of the things that's quite amazing about this as compared to SARS. The genomic sequencing shared internationally very rapidly, not only of the B117, but the other ones, of course, add that to their dictionary, if you may use that term, that they can look at matching that. So I think you're asking about all the genomic sequencing they've done as compared to the specific one around the UK variant. Is that what you're asking?
Yeah, so you're saying 6,000 samples where you've done the genetic sequencing since the beginning of the pandemic, but how many are you specifically looking for the UK variant?
So the one specific in the UK, I can ask Dr. Yaffe to comment on that, but of course, I was talking about the 6,000, that was before the UK variant that they've been doing throughout, as they take certain percentage and sample so many every now and again to see if there's any variations that we're seeing, much like the UK was doing. So if we had a variant that was significant, we would know about it. We hadn't seen anything that we've been reported out of those ones up until the UK variant. And I think Dr. Yaffe has answered that, whether she knows how many on that. They're going to be doing some basis on that on a go-forward basis.
Yeah, I don't know the specific number, but what I can tell you is, Public Health Ontario is working in collaboration with many other lab and academic partners, both in Ontario and across Canada, including the National Microbiology Lab, to develop a system for looking at the genomics. And right now, the samples that are being tested for the UK variant at the Public Health Ontario are anybody who's positive for COVID-19 that has had a travel history or has a contact with a travel history, any sample that's involved with a person who was what we call a super spreader, who was associated with at least a number of other cases. And also, certain labs are looking for a pattern that's consistent with the UK variant and submitting them to Public Health Ontario. There's a few of those that look at 3 separate gene targets, including, of course, the S or spike gene. So, and they're looking at some random samples as well. So we're going to be able to have some kind of routine reporting on the genotyping for the UK variant, and so far we haven't had any of the South African variant, but that they're looking for that as well. And of course, it's a virus. Viruses mutate, so there may be others as well.
Thanks, everyone.